Congratulations on entering the second week of your pregnancy. You may not even realize that you are pregnant yet, as this is still considered the very early stages of pregnancy. However, there are some important things that you should know about this stage of your pregnancy. In this video, we will cover everything you need to know about the second week of pregnancy, including symptoms, baby development, care, and considerations. Thank you so much for tuning into our videos. We notice that only 2.1% of our audience is currently subscribed to our channel. If you're enjoying our videos and find them helpful, we encourage you to hit that subscribe button and turn on notifications. It only takes a few seconds, and it means the world to us. Timing of the second week of pregnancy. The second week of pregnancy is typically calculated from the first day of your last menstrual period, LMP. This is because it can be difficult to determine exactly when conception occurred, so healthcare providers use the LMP as a way to estimate your due date. It's important to remember that not all women have a 28-day menstrual cycle, and not all women ovulate on day 14 of their cycle. If you are unsure when your LMP was or when you ovulated, your healthcare provider can help you determine your due date and estimate the timing of your pregnancy. Symptoms of the second week of pregnancy. During the second week of pregnancy, you may start to experience some very mild symptoms. Some women may not experience any symptoms at all during this time. However, if you do experience symptoms, they may include light spotting. You may notice some light spotting or bleeding, which is caused by the implantation of the fertilized egg in your uterus. Breast changes. Your breasts may start to feel tender or sore, and they may also become slightly larger. Increased cervical mucus. You may notice an increase in cervical mucus, which is a normal part of pregnancy. It's important to note that these symptoms can also be caused by other factors, such as hormonal changes or ovulation. If you are unsure whether you are pregnant, it's best to take a pregnancy test or consult with your healthcare provider. Baby development in the second week of pregnancy. During the second week of pregnancy, your baby is still very tiny and is only just beginning to form. At this stage, your baby is known as a blastocyst, which is a ball of cells that will eventually develop into your baby. The blastocyst will implant itself into the lining of your uterus, where it will receive nourishment and begin to grow. The blastocyst will also develop into two different layers of cells, the inner cell mass and a trophoblast. The inner cell mass will eventually become your baby, while the trophoblast will become the placenta, which is responsible for providing nutrients and oxygen to your growing baby. Care and considerations in the second week of pregnancy. During the second week of pregnancy, it's important to take care of yourself and your growing baby. Here are some tips to help you stay healthy during this early stage of pregnancy. Take a prenatal vitamin. Taking a prenatal vitamin that contains folic acid can help reduce the risk of birth defects. Avoid harmful substances. It's important to avoid smoking, alcohol, and drugs, as these substances can harm your growing baby. Eat a healthy diet. Eating a healthy, balanced diet can help provide the nutrients that your baby needs to grow and develop. Get plenty of rest. Rest is important during pregnancy, so make sure to get plenty of sleep and take breaks when you need them. Stay hydrated. Drinking plenty of water can help prevent dehydration and promote healthy blood flow to your growing baby. Sexual activity during the second week of pregnancy. During the second week of pregnancy, sexual activity is generally considered safe as long as there are no medical complications or concerns. However, some women may experience increased sensitivity or discomfort during intercourse due to hormonal changes in the body. If you have any concerns or questions about sexual activity during pregnancy, it's important to discuss them with your healthcare provider. Emotional support during the second week of pregnancy. During the second week of pregnancy, you may experience a range of emotions as you process the news of your pregnancy and the changes that are happening in your body. It's important to take care of your emotional well-being during this time, as stress and anxiety can have a negative impact on your health and the health of your baby. Here are some tips for emotional support during the second week of pregnancy. Talk to your partner or a close friend. Sharing your feelings and concerns with someone you trust can help alleviate stress and provide emotional support. Join a support group. Joining a support group for pregnant women can provide a sense of community and help you connect with others who are going through similar experiences. Practice relaxation techniques, yoga, meditation, deep breathing, or other relaxation techniques can help reduce stress and promote emotional well-being. Seek professional help. If you're feeling overwhelmed or struggling with your emotions, consider speaking with a mental health professional. By following these tips and guidelines, you can help ensure a healthy pregnancy and promote the development of your baby. Remember to take a prenatal vitamin, avoid harmful substances, eat a healthy diet, get plenty of rest, and stay hydrated. If you are experiencing any symptoms or have any concerns, be sure to consult with your healthcare provider. Your healthcare provider can provide you with the information and support you need to have a healthy pregnancy and a healthy baby. Subscribing to our channel is the best way to stay up to date on our latest content and receive notifications when new videos are posted.